The clinic is for anyone really who identifies as having some sensory issues with the vaccine clinics. And so it for sure is something that many people on the autism spectrum might appreciate, but there are other individuals as well who might not have an autism diagnosis, but definitely have difficulty in that kind of overwhelming sensory environment of a traditional vaccine clinic.
So the clinics were created in partnership with the Autism Society, and they're a clinic that is to help children who may struggle with the traditional ways of our vaccine clinics to get immunized.
New spaces are difficult for anybody, but particularly so for children with autism spectrum and with other sensory difficulties. It can be very intimidating and noisy.
Creating a clinic where it's just them and their family and the people they're familiar with is really important. It takes away some of the anxiety, some of the distractions.
It was really important to try to take some of that away. And so having private appointments as an option has been, I think, a game changer.
These appointments are longer in length. They're 30 minutes long. They are in a very quiet environment. There's no other, people around. It's just the family that's present. And we've kind of taken a lot of the noise away. We've dimmed the lights and created an environment that is more soothing and quiet and I guess more friendly for those children.
We were very grateful to receive the donation from the Autism Society, and they certainly know what kinds of devices and toys and tools can be particularly helpful for their population. And so they made a very generous donation to a clinic here in Charlottetown and also in Summerside. And they include a variety of things. There's a really nice light and noise machine that plays really soothing music while also projecting lights onto the ceiling, which is a really nice atmosphere creator. Toys that are fidget toys. There's some that you can watch, like fluid moving through children with sensory difficulties. Some really are seeking different sensory experiences, and some are more trying to avoid sensory experiences. So there's even noise canceling headphones for children who really want it to be very quiet, or there is something that they can kind of touch and feel that is gives them really strong sensory feedback if they're more seeking. So we're really trying to facilitate kind of multiple kind of experiences for them.
They would come in and they would meet the nurse. The nurse might have a few questions for their parents. They could kind of get used to the space and look around and explore a little bit. We would immunize them, so it would be kind of just exposing their arm, cleaning off the area and giving them the immunization. And then following immunizations, there is a 15-minute observation period. So during that period, they would be able to stay here and just kind of relax or explore the toys that we have, or just kind of move around.
After our first vaccine clinic, I bumped into a family that I've worked with in the past in the hall here at the Sherwood Business Center, and she was so happy and so relieved. And she talked about her first attempt at the vaccine having gone so poorly and been unsuccessful, and how this really made a very big difference for her. Her daughter was relaxed and happy and able to talk about it in a way that just indicated it was worth it just for that one person.
So you could just call our main number at any of the offices across the island, and we can talk to a nurse. There's lots of people that you can talk to that we can learn about ways that would make a difference for you or your family, and work together to make it a positive experience.